Year after year, the ASH annual meeting offers unique sessions that focus on hot topics in the field of hematology. Sessions like this one on Sunday that addressed questions about maternal health, fertility preservation, and hematology care.
I hope the session really helped people understand the importance of the conversation, whether it's making time to have a conversation about fertility issues with a patient. It can be very hard when somebody's just been diagnosed with cancer, but I think Dr. Lauren and the other speakers made it clear how important it is to have those early discussions. And I think that Dr. Christensen's part about talking about how this affects physicians and trainees helps us know that as mentors, this is something that we have to think about, and maybe, don't be afraid to talk to our trainees about it and make them aware that that door is open if that's something that they have concerns about or want to talk to us about.
And the special session on race and science that explored how the concept of diversity, equity, and inclusion can be incorporated into trial design to ensure broadly generalizable results and therapies that are inclusive.
That we really need to start looking at the questions that we're asking in order to really accelerate discovery and to ensure that we are making sure that everyone gets the best access to quality care and treatments, but also that our research is asking the questions that are not based on inequities, that are not based on biases, and also those questions that are based on the last study, based on the prior study and the study before that. At some point, we've got to interrupt that to make sure that the implications from prior studies are not being carried over, that actually are really hurting particularly minoritized populations.
For those focused on quality improvement, this year's special symposium on quality highlighted several successful projects identifying and addressing underuse in hematologic care.
One of the topics today is on IVC filters, which are often placed to prevent a certain kind of blood clot, and they get placed very often, but they don't often get removed. Not getting removed can be associated with a lot of complications, and so this is one of the things we want to promote here. We're also going to be talking about underuse of a certain drug, hydroxyurea, for sickle cell disease, which is known to be very effective, but not always prescribed as much as it should be. And then finally, we're going to be talking about patient education for patients who are on anticoagulation, because they're prescribed very often, but patients aren't always given all of the education they need to use them optimally and know how to recognize potential issues.
Another quality-oriented session focused on guideline implementation champions, recognized by ASH for successfully putting guidelines into practice.
Studies have shown that it can take up to 17 years for groundbreaking research to be translated into successful clinical practice, and then to be written up in clinical guidelines, and then to be adopted in wider medical community. 17 years is a very long time. And so there is a big initiative and push to try and reduce that length of time by trying to speed up the process where clinical guidelines are written up and it's being implemented into clinical practice. We want to tell people ASH has been very successful in publishing the guidelines, but how are people implementing them? There's no point having a guideline if no one's using them.
Joint scientific committee sessions are also highly anticipated as they cover cross-cutting issues. From ontogeny and myeloid disorders of childhood to lymphomagenesis, the ASH annual meeting is where hematologists come to hear about the groundbreaking research that's moving the field forward.
Yeah, I think it's so cool to see a lot of speakers and also a lot of updates on new therapies and also guidelines. So I'm very excited to learn a bit more about that.
You learn about everything else, not only about your own field, but also when you are on service and you're on consult service, you need to see everything in hematology. I get to learn a lot, and I get up-to-date information on what's the latest. For example, there are some new drugs that I didn't even know that existed, and I'm like, wow, it's a good opportunity to catch up on all the advances in the field.